Welcome to today's video about symptoms of enlarged prostate. Have you ever wondered why so many men silently suffer from urinary problems without realizing what's really happening inside their bodies? Why is it that discussions about prostate health are often brushed under the rug, even though millions are affected every year? The truth might surprise you. Right now, over 200 million men worldwide are living with an enlarged prostate. Yet many have no idea what the early warning signs even look like. Research from the World Journal of Urology shows that by age 60, more than 50% of men will experience symptoms, and by 85, it jumps to over 90%. That's not just a statistic, it's a wake-up call. What if I told you that spotting the early symptoms could not only save you from serious discomfort, but might even prevent bigger health risks down the road? Symptoms that seem small, like a weak urine stream or sudden urges, could be your body's early distress signals. Stay with me, because in today's video, we're diving deep into the 11 critical signs you need to watch for. And the number 7 symptom might just be the one you've been ignoring all along. Trust me, you don't want to miss it. Before we jump in, if you're new here, welcome. Hit that like button, subscribe, and let's build a healthier future together. And hey, drop your country in the comments. We love hearing where you're tuning in from. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's jump right into the symptoms of an enlarged prostate, beginning with number 1, frequent urination. Imagine you're heading to the bathroom way more often than usual, even waking up several times a night. It's frustrating, right? Frequent urination is actually one of the clearest signs that the prostate gland might be enlarged. As men age, the prostate, a small gland just below the bladder, can grow bigger. When that happens, it puts pressure on the urethra, the tiny tube that carries urine out of the body. This pressure makes it harder for the bladder to empty completely, forcing you to run to the bathroom again and again, even if only a little bit comes out. A 2023 study published in the International Journal of Urology found that men with benign prostatic hyperplasia, or BPH, reported a 67% increase in daytime urinary frequency compared to those without prostate enlargement. Researchers highlighted that as the prostate grows, it disrupts the bladder's normal storage ability, leading to more frequent urges even when the bladder isn't full. Think of your bladder like a balloon that's being squeezed. Even when it's barely half full, it sends out a full signal because of that constant pressure. That's why frequent urination isn't just annoying. It's a real clue from your body that something deeper is happening. Next, number 2, Nocturia. A lot of men notice they're getting up more often at night to pee, and they wonder what's going on. One big reason behind this could be an enlarged prostate, also known as BPH. As men age, the prostate tends to grow. This extra growth presses against the urethra, the small tube that carries urine out of the body. When that happens, the bladder has to work harder to push urine through the narrowed pathway. Over time, the bladder can become overactive, meaning it signals the need to empty even when it's not full. Recent research shows this isn't just about age or drinking too much water before bed. A 2023 study published in BMC Urology found that men with BPH have a 2.5 times higher risk of developing nocturia compared to those without prostate enlargement. They explained that incomplete bladder emptying during the day leads to more frequent nighttime urination because the bladder fills faster with smaller amounts of urine. If you're waking up once, twice, or even more times every night just to go to the bathroom, it's not just getting older. It might be your body's way of hinting that your prostate needs a checkup. Staying ahead of it can make a huge difference in sleep and health. Next, number 3, hesitancy. When the prostate grows larger, it doesn't just sit quietly. It wraps around the urethra, the tube that carries urine out of the body, and slowly starts squeezing it. This pressure makes it harder for urine to flow freely. That's why a lot of men find themselves standing at the toilet, feeling the urge to go, but struggling to actually start the stream. It's frustrating, awkward, and often very confusing if you don't know why it's happening. Medical studies back this up clearly. A 2023 study, published in the Journal of Urology, found that men with moderate to severe prostate enlargement were 3.6 times more likely to experience urinary hesitancy compared to those without BPH symptoms. Researchers explained that the enlarged prostate creates a physical obstruction, but it also messes with the bladder's natural signals, causing even more delay in starting urination. If you've noticed yourself standing there longer than usual, or needing to really focus just to get things moving, it's not just getting older. It could be a real sign that the prostate needs a closer look. Catching these small changes early can make a huge difference later on. Next, number 4, weak urine stream. As men age, the prostate gland can enlarge, a condition known as benign prostatic hyperplasia. This growth can press against the urethra, the tube that carries urine out of the body, narrowing its passage. Consequently, the bladder must exert more effort to push urine through this constricted pathway. Over time, this increased workload can weaken the bladder muscles, leading to a noticeable decrease in the force and volume of urine flow. A recent study published in the Frontiers in Public Health, 2024, found that approximately 60% of men over the age of 60 with BPH reported a significant reduction in urine stream strength. This weakening of the stream often leads to incomplete bladder emptying, which can cause further complications if left unaddressed. If you're experiencing a diminished urine stream, it's essential to consult a healthcare professional. Early intervention can prevent potential complications and improve quality of life. Next, number 5, incomplete bladder emptying. When the prostate grows larger, it can push into the bladder, creating a blockage that makes it hard to fully empty your bladder. This condition, known as intravesical prostatic protrusion, can act like a valve, closing off the bladder outlet during urination. As a result, urine flow is restricted, and some urine remains in the bladder even after you think you're done. A study published in 2023 in the journal Prostate Cancer and Prostatic Diseases found that higher post-void residual volumes, meaning more urine left in the bladder after urination, are linked to worse urinary symptoms and a lower quality of life in men with an enlarged prostate. This research highlights how incomplete bladder emptying isn't just uncomfortable. It can also lead to other issues like urinary tract infections or bladder stones over time. If you're experiencing a lingering feeling after urinating, it's not something to ignore. This sensation could be a sign that your prostate is pressing against your bladder, preventing it from emptying completely. It's important to consult a healthcare provider to discuss your symptoms and explore potential treatments. Next, number 6, dribbling at the end of urination. Dribbling after urination isn't just an inconvenience. It can be a sign of something more. Many men experience this, especially as they age, and it's often linked to an enlarged prostate or benign prostatic hyperplasia. Here's what's happening. As the prostate enlarges, it can compress the urethra, the tube that carries urine out of the body. This compression can prevent the bladder from emptying completely. So, even after you think you're done, some urine remains and may leak out later. A 2023 study published in Urological Science examined over 1,000 men aged 31 to 86 and found that 22.4% reported significant post-micturition dribble. The study noted that PMD prevalence increased with age and was associated with decreased peak urinary flow rates, suggesting a link to voiding dysfunction. If you're noticing this symptom, it's important to talk to your doctor. They can assess whether BPH or another condition is the cause and discuss treatment options with you. Next, number 7, painful urination. This discomfort often arises because the enlarged prostate presses against the urethra, narrowing its passage. This constriction can cause inflammation and irritation of the urethral lining, making urination painful. Additionally, the obstruction can lead to urine remaining in the bladder after voiding. creating an environment conducive to infections, which further exacerbate the burning sensation. Recent studies have highlighted the significance of the prostate's median lobe in this context. When this central part of the prostate enlarges, it can protrude into the bladder, a condition termed intravesical prostatic protrusion. This protrusion can intensify urinary symptoms, including pain during urination. Notably, patients with significant IPP often respond less favorably to standard medications, suggesting that surgical interventions might be more effective in such cases. If you're experiencing a burning sensation during urination, especially if you're over 50, it's essential to consult a healthcare professional. Early evaluation can lead to effective management strategies, improving comfort and quality of life. Next, number 8. Bladder stones. As men age, the prostate gland can grow and press against the urethra, the tube that carries urine out of the body. This pressure can make it harder to empty the bladder completely. When urine stays in the bladder for too long, minerals in the urine can crystallize, forming stones. One key factor is something called intravesical prostatic protrusion. This occurs when part of the enlarged prostate pushes into the bladder, further blocking urine flow. A 2023 study in the Asian Journal of Andrology found that men with significant IPP were more likely to develop bladder stones. The study also noted that these men had a higher chance of needing prostate surgery later on. In fact, research shows that about 66% of adults with bladder stones experience symptoms like frequent urination or difficulty starting to urinate. However, some might only notice recurring urinary tract infections. If you're dealing with urinary issues, it's essential to consult a healthcare provider. They can determine if an enlarged prostate is the cause and discuss treatment options to prevent complications like bladder stones. Next, number 9. Blood in urine. Blood in the urine, or hematuria, can be a startling sight. For men, especially those over 50, one possible cause is an enlarged prostate. As the prostate grows, it can press against the urethra and bladder, leading to various urinary issues. One of these is the appearance of blood in the urine. This happens when the enlarged prostate causes blood vessels in the urinary tract to rupture, allowing blood to mix with urine. This condition is not uncommon and warrants medical attention to determine the exact cause and appropriate treatment. In a study published in the journal Current Urology, researchers analyzed 166 men who presented with hematuria. They found that in many cases, the bleeding was due to an enlarged prostate rather than cancer. The study emphasized the importance of thorough evaluation to rule out malignancy and highlighted that benign prostatic hyperplasia can be a significant cause of hematuria in older men. If you notice blood in your urine, it's essential to consult a healthcare provider promptly. They can perform the necessary tests to determine the cause and recommend appropriate treatment. Early diagnosis and management can help prevent complications and ensure better health outcomes. Next, number 10. Urinary tract infections. When the prostate grows larger with age, it can press tightly against the urethra. This narrowing often causes incomplete emptying of the bladder. Over time, when urine is left sitting in the bladder, it becomes a breeding ground for bacteria. That's why men with an enlarged prostate are more likely to develop urinary tract infections, UTIs. It's a frustrating cycle. The harder it is to fully empty the bladder, the higher the chances that harmful bacteria can settle in. Recent studies are giving us more clear insights too. A 2023 study published in the Prostate Journal found that men with prostate enlargement had nearly 2.5 times higher risk of developing UTIs compared to men without prostate issues. This research highlighted that stagnant urine due to obstruction is a major reason behind repeated infections. If you or someone you know has been fighting off UTIs more often, it's not just bad luck. It could be your body trying to tell you something about your prostate health. Getting checked early could save you from much bigger problems later. Always listen to what your body is trying to whisper before it starts shouting. Next, number 11. Sexual dysfunction. An enlarged prostate can subtly interfere with a man's sexual health, often in ways that aren't immediately obvious. As the prostate grows, it may compress surrounding nerves and blood vessels vital for achieving and maintaining an erection. This pressure can disrupt normal blood flow and nerve signaling, making it more challenging to attain full erectile function. Recent research underscores this connection. A 2024 study published in Frontiers in Endocrinology analyzed data from over 2,200 men and found that those with prostate enlargement had a 47.6% prevalence of erectile dysfunction, significantly higher than those without. The study concluded that an enlarged prostate is an independent risk factor for ED, especially in men aged 60 to 80 years. Beyond the physical aspects, the psychological impact of an enlarged prostate shouldn't be overlooked. Men may experience anxiety or stress related to urinary symptoms, which can further exacerbate sexual dysfunction. This interplay between physical and emotional factors creates a complex scenario where the prostate's enlargement indirectly affects sexual performance. It's essential to recognize these signs early. If you're noticing changes in your sexual function, it might be more than just aging. Consulting with a healthcare professional can provide clarity and open the door to effective treatments that address both prostate health and sexual well-being. And that wraps up today's video on the key symptoms of an enlarged prostate. If you learned something new or this helped you better understand your health, don't forget to hit that like button and subscribe. It truly helps our channel grow and reach more people who need this information. We'd also love to hear from you. If you found this video helpful, type "helpful" in the comment box below. Your feedback keeps us motivated to create even more valuable content just for you. Thank you so much for watching and being part of our amazing community. Stay tuned for more health insights coming up. And remember, taking small steps today leads to a healthier tomorrow. See you in the next video.